Did you know that muscle injuries represent one of the main causes of removal in sports and work? I imagine that if you practice sports or train regularly, you must have already felt that unexpected pain in your muscle, right? Muscle injuries are common, but with the right tips it is possible to prevent and treat these situations effectively. In today's video we will teach you everything about the subject, understand what they are, how to treat them, and most importantly, how to prevent them. My name is Jessica, my name is Sarah, and stay with us until the end, because the tips can make all the difference in your training and in everyday life. After all, do you know the causes of muscle injuries? Basically, muscle injuries have main causes such as overload, muscle fatigue, excessive stretching, lack of heating, direct traumas, muscle imbalances, poor posture, repetitive movements, lack of flexibility, and errors in the exercise execution technique. Injuries occur when there is excessive effort or inadequate movement, which results in strains or ruptures of muscle fibers. The degree of injury can vary from a simple stretch to more serious rupture. What we will address today, well, we will highlight the main classifications of muscle injuries, and also methods of prevention and treatment for better health. Skeletal striated muscle tissue, as its name indicates, is attached to the bones, and has long cells with many nuclei, multinucleated. The nuclei of these cells are located on the periphery, near the sarcolemma, plasma membrane of muscle tissue cells. Its possible causes are physical disability in sports practice associated with sport by soft tissue injuries. Possible treatments, if always non-surgical, result in good prognosis in most athletes. The mechanism of muscle injury is usually due to trauma, direct or excessive stretching in the muscle belly, in movements of acceleration or deceleration. The higher the intensity, frequency, and duration of physical activities, the injured muscle tissue suffers structural damage that varies according to severity, distension, microlesions in muscle fibers without total rupture, causing pain and inflammation. Contusion, direct trauma generates compression of the muscle, which can cause hematomas. Partial or total rupture, the muscle breaks partially or completely, resulting in intense pain, swelling, and loss of function. The body responds with inflammation and regeneration, but in severe cases, there may be scar formation that affect muscle elasticity and strength. Other injuries include cramps, involuntary contractions, and myositis, inflammation. Symptoms involve pain, swelling, and difficulty in movement. Treatment varies from rest to physiotherapy or surgery. Prevention includes warming, stretching, and strengthening. Muscle injuries can be stretches, bruises, or ruptures, caused by excessive effort, fatigue, or lack of heating. They mainly affect legs, back, and shoulders, causing pain, swelling, and loss of strength. Recovery occurs in 3 phases: inflammatory, repair, and remodeling. The initial treatment includes the RICE protocol, rest, ice, compression, and elevation, while physiotherapy is essential for rehabilitation. Excessive use of anti-inflammatories can harm healing. Supplementation with proteins and collagen helps in recovery. Preventing injuries requires muscle strengthening, proper stretching, and progressive training. Current principles for the treatment of muscle injuries lack solid scientific evidence. Early mobilization improves vascularization and muscle regeneration, but can increase the risk of re-ruptures. A short period of immobilization with firm bandage is recommended to allow healing. In severe cases in the lower limbs, the use of crutches is indicated in the first 3 to 7 days. And studies dispute the effectiveness of stretching in preventing injuries. On the other hand, the strengthening of the adductor and hamstring muscles has been shown to reduce injuries. Muscle strength asymmetry is a cause of injuries, and muscle balance helps prevent them. Warming, although common, has little evidence that it actually reduces injuries. The strengthening of the hamstrings, specifically, has been shown to be effective in reducing injuries in this group. Injury remains a topic with several controversies. New treatments are being researched and developed. Prevention with muscle strengthening, stretching, and muscle balance remains the best treatment. Now stay with some of the references we used to make this amazing video for you. However, these were some tips for prevention and also treatment. Remember, a good workout is done with caution and attention. If you liked it, like, comment, and share. And follow us on social media. Kisses.